Hi, congratulations in completing the hardest part, your surgery. My name is Francis Savas.
And my name is Christina Connolly. We are both Doctor of Nursing practice students, and you are watching this video because you agreed to participate in a doctoral nursing practice project.
We want to thank you for participating in our project. Our main goal is to help you manage your pain during the recovery process.
Remember, your participation in this project is voluntary, so if at any point you would like to stop, you are under no obligation to watch this video or continue with the project.
This video is designed to complement the pamphlet you received at the hospital. Please, feel free to refer to the pamphlet as a guide for the video, and feel free to rewind and or replay as much as needed in case something does not make sense.
Life after surgery is a challenge. You may experience increased fatigue, breathlessness, pain at the surgical site, and difficulty with activities of daily living. Nurses and physicians are here to help you manage your pain and be comfortable. It is crucial that they are aware of how much pain you are experiencing. Don't hold back. Effective pain management can help speed your recovery and reduce the risk for complications, such as pneumonia and blood clots. Having less pain will allow you to complete important tasks, such as walking and deep breathing exercises. By effectively treating your pain, you will not only heal faster, but you should also be able to go home and resume normal activities sooner.
You just had major surgery. As a result, it is normal and expected that you will experience a significant amount of pain, especially around the incision areas in your chest, including numbness and tingling sensations. In addition, after a day or two, you may also experience general discomfort and soreness around your chest and stomach, even if there are no incisions present. The goal of pain control after surgery is not to take away all the pain from your procedure. In other words, pain management is intended to lower the amount of pain you are experiencing, while allowing you to be comfortable performing basic tasks such as taking deep breaths, coughing, walking, and sleeping. Be mindful that your pain level will continue to decrease throughout the recovery process, and we want to avoid the development of tolerance towards powerful pain medications.
After surgery, while you are admitted in the hospital, what are your pain medication options? How do you take your pain medication? Well, you will receive medications that are both scheduled and available on an as-needed basis for when your pain becomes too severe. For scheduled medications, this means that the provider has prescribed these medications to be taken on a regular schedule throughout the day to help with pain management. You do not have to ask the nurse for these medications, as they will already be a part of your pain management schedule. Some of these medications may include Tylenol, Neurontin or gabapentin, Toradol, and for your as-needed medications, these are options that are available to you for when your pain becomes unbearable. If at any time during your stay your pain becomes unmanageable, reach out to your nurse. The most common as-needed medication is an opioid-based medication called oxycodone. These can treat severe pain quickly, but should be used sparingly due to their potential serious adverse effects that include developing tolerance, drowsiness, nausea and vomiting, constipation, itchiness, and when taken in high doses, can even restrict your ability to breathe. Make sure to ask your nurse and or your provider about any information that does not seem clear regarding these medications.
Now we're going to go over your pain medication options following hospital discharge. Congratulations, you have overcome a great hurdle and can now enjoy the comfort of being back home. When you go home, you may notice that your pain is slightly worse in the first few days due to increased movement or activity. Unless there are contraindications, most patients who undergo thoracic surgery are discharged with 3 common pain medications, pretty much similar to what you were taking during your time at the hospital. These consist of Tylenol, also known as acetaminophen, Neurontin, also known as gabapentin, and oxycodone. While at home, we would suggest grouping your pain medications into scheduled and as needed, just like when you were in the hospital. Scheduled medications, these include Tylenol and gabapentin. Just like in the hospital, these medications are to be taken around the clock, usually every 8 hours. As needed medications consist of medications such as oxycodone. These medications should be used on an as needed basis and only if your pain becomes unbearable. These medications act very quickly, decreasing pain within 30 minutes to 1 hour. They should only be used sparingly due to the potential for serious adverse effects as discussed previously. It is important to follow the medication's instructions regarding when to use them and how frequently. When not taken properly, multiple adverse effects can occur, including death. Oxycodone is a narcotic medication. As a result, you should not operate a motor vehicle or engage in any other potentially dangerous activities, as they can cause significant drowsiness. Despite these adverse effects, remember that as-needed opioid medications are an integral part of your pain management program, especially after significant surgery. You will be experiencing a lot of pain throughout this process initially, so please do not be afraid to ask or use these medications. Opioids, when used appropriately and as prescribed, are safe to use. If your pain does not improve with these medications and continues to worsen, please call the thoracic surgery number listed on your discharge papers immediately. Your pain may need to be further assessed and treated accordingly.
All right, so your pain is improving. What's next? Well, we recommend a stepwise approach when discontinuing your pain medications. The first pain medication to stop is oxycodone. If, after 24 hours, the pain remains well controlled, gabapentin can then be stopped. Additionally, if after 1 to 2 days the pain still remains well controlled, you can then change from taking acetaminophen, also known as Tylenol, from every 8 hours to only as needed.
Now, we're going to go over non-pharmacological methods to manage your pain. We want to remind you that you can regain control of your body again. Thankfully, there are options to manage your pain at home. These options can help decrease anxiety, pain, and stress while improving your functional status and overall recovery. First, make sure to move as much as possible early on. Stay ahead of the pain, get enough sleep, and know what to expect. These non-pharmacological interventions entail the following. Physical interventions, for example, include application of ice packs, sitting upright to improve posture, and walking around the house multiple times a day. Some psychological interventions include distraction techniques, relaxation therapy through meditation, guided imagery, music, and/or art. To help with your sleep, remember that this is a crucial part of recovery that aids in healing, so get enough sleep. The use of opioids as a sleep aid, remember, is not recommended. If these do not work for you, it is always recommended to follow up with your provider.
Now that you've made it to the end of the video, let's summarize the main takeaways. The goal of pain control after surgery is not to take away all pain related to your procedure. Instead, successful pain management is when you are comfortable performing basic functions such as taking deep breaths, coughing, walking, and sleeping with an acceptable level of pain.
Following hospital discharge, your pain may become slightly worse during the first few days after going home. Most patients will go home with the following 3 pain medications: Tylenol, also known as acetaminophen, Neurontin, aka gabapentin, and oxycodone. Tylenol and gabapentin are scheduled medications and should be taken around the clock. Oxycodone, on the other hand, is an as-needed pain medication used to treat severe and unbearable pain. Each of these medications have adverse effects, including drowsiness or becoming habit-forming. They can also lower your respiratory drive and even cause death if they are not taken properly.
Opioids are prescribed to help you manage severe pain episodes and are designed for short-term use.
Despite these adverse effects, remember that as-needed opioid medications are important for initial pain control as you recover from a major surgical procedure. When used appropriately and as advised, these medications are safe to use.
When your pain is improving at home, we recommend a stepwise approach when discontinuing your medications.
Seek out non-pharmacological interventions to help manage your pain, such as physical and psychological interventions, and getting a good night's sleep.
To optimize the best pain management program, try to utilize a combination of non-pharmacological and pharmacological options.
Congratulations! You have made it this far. You are well on your way to your full recovery.